Okay, in this video we're going to go over the initial survey, and then we'll move into some x-ray scans of the abdomen and start looking at the various patterns that you want to get good at recognizing in order to be able to quickly and easily recognize the anatomical structures that you see in the abdomen. So with the initial survey, the overall idea here is to look for gases and masses, bones and stones. So the first thing to do is to look at the overall gas pattern, and we'll talk more about what I mean by that, but you're looking for gas in the stomach, gas in the intestines, and then some other areas like in the rectum where you might see some gas there as well. You're also going to check for extraluminal air, so that's gas or air that has usually pathologically entered the abdominal cavity, and so we call this extraluminal, meaning it's outside of the lumen of the GI tract, and so we call that free air in the abdomen. You're also going to look for abnormal abdominal densities, so those are going to be the masses that I mentioned in the gases and masses. Same thing with soft tissue masses. You'll look for concretions and stuff of that nature. There's also potentially, with abnormal densities, stones, so kidney stones, gallbladder stones, etc. And then finally you want to look at the bony structures of the abdominal cavity as well, though many of these surveys are, well, if you're in a orthopedic specialty, of course that would be an area where you'd definitely be looking at the bones, but much of the time abdominal x-rays are performed to determine why somebody is experiencing abdominal pain. That's far and away the most common reason, though there are situations like with a patient with scoliosis or kyphosis or some other skeletal abnormalities, potential fractures, trauma, where a abdominal x-ray might be taken to observe the bony structures. So to go back and review the stomach, you can see the esophagus descending through the abdomen, through the, there we go. You can see the esophagus descending through the thorax to the abdomen. So here's the gastroesophageal junction right here. So this is going to be the cardia of the stomach. You can see the fundus, and then this yellow line represents the junction between the fundus and the body of the stomach. You can see the greater curvature and the lesser curvature. This line represents the border between the body of the stomach and the pyloric antrum, and then between the pyloric antrum and the pyloric canal. And then this line represents the orifice of the pyloric canal, which is also represented by the muscles that you see right here, which are, of course, the pyloric sphincter, controlling the movement of chyme or food from the stomach into the duodenum distally. So the stomach on plain film radiology is not usually well appreciated. You can see it, but you're not going to be able to usually see it in its entirety. But the one thing that you should be looking for is the gastric bubble, like what we talked about in the thoracic imaging section. So you'll see gas outlining the fundus of the stomach in an upright individual. So in this person, you can clearly see on the left side here, so this is the fundus of the stomach, and so therefore this is the gas bubble. So this is a fluid gas line right here. So the fluid is below that, and the gas is above it. But keep in mind that the location of the gas is going to change in an upright versus a supine or a prone individual. So another way that abdominal scans are commonly taken is in a supine individual, and so in that case the air is going to move towards an anterior position, usually somewhere in the body or potentially in the antrum, the pyloric antrum of the stomach. And you can also see the diaphragm, the dome of the diaphragm here on the left, dome of the diaphragm on the right over here with the liver below it. You can see some of the lung lines in there as well. So gas, one thing that you're looking for is the gas bubble in the stomach. And again, the yellow line here is just pointing out the fact that you have the fluid gas interface or fluid line, as we call it, where you can clearly see the fundus of the stomach. Here's a upper GI barium swallow study where the patient has swallowed barium, a barium contrast agent, so you can now much better, you have a much better visualization of the stomach in this case. So again, you can clearly see the fundus. most of the contrast agent is moving through the body down towards the pyloric region of the stomach, and then you can also see it moving down into the duodenum. So you can just make out parts of the duodenum right here, and then this feathery appearance is a very characteristic appearance of the jejunum, and to a lesser degree the ileum, but you can clearly see that would be the jejunum right there. This is a lateral view in the same patient, so we're just going to go through a series of images in this patient. So once again, you can see the contrast agent here in the pyloric region. You can see the sphincter, where then it's moving into the duodenum down here. So this all represents the duodenum. Just to get you oriented a little bit as well, in case you're struggling with that. Here is the spine, so you can see the vertebral bodies and the intervertebral foramina located right there. So again, this is posterior, this is anterior, and again, this is a lateral view. Here's another AP view on this patient, and so we can see again the flow through now is occurring through the duodenum, and so the jejunum is filling up much more prominently now with the contrast agent, and again, you can really appreciate that characteristic feathery appearance of the jejunum. UGI here just stands for upper GI study with a small bowel follow through. So the stomach is still lit up here, but now you can also see some of the more distal regions from the first part of the swallow, where you can make out the feathery appearance of the jejunum, and then over here you can make out the ileum quite effectively, and you can also even see that these dark outlines here actually represent mesenteric fat that's separating the bowel loops from each other. So again, you can see it less prominently in some regions and much more prominently in others. So the length of the small intestines may vary from about 3 meters all the way up to 10 meters, just depending on the age, sex, and individual anatomy of the person that's being imaged. The duodenum usually is about 25 centimeters in length, so obviously that's by far the shortest of the 3 segments of the small intestines and small bowel. The jejunum is about 2.5 meters, and the ileum is the longest at about 3.5 meters in an average person. The plicae or plicae circularis are going to be very evident, but less prominent more distally. So again, that's what gives the feathery appearance to the jejunum. You can also see that, of course, in the duodenum to a lesser degree, and then also to a lesser degree in the ileum. So some other structures that are easy to appreciate on some abdominal X-rays. So we're going to look at the structures that you can easily see on this one. So the transverse colon should stick out to you quite prominently here. So you can see that cutting across the abdominal cavity. The liver margin you can make out as well over here. The splenic flexure, of course, that's part of the large intestine as well. So the splenic flexure located right here. The inferior margin of the left kidney, so you can see the left kidney coming down right here. So it's going to be protected there by the 12th rib. You can see the 11th rib just above that as well. But again, this is going to be the inferior margin of the left kidney. Right next to that, you'll see the lateral margin of the psoas major muscle. So I'm outlining the psoas major muscle for you there. The ascending colon, you can see right here quite well. And then the descending colon, you can also very well appreciate here. The sigmoid colon, you can see the distal continuation of that down here, and eventually making its way down into the rectum. Oftentimes it's difficult to tell the exact transition from the sigmoid colon to the rectum, but depending on the individual, sometimes you can see a very distinctive transition. Here's another X-ray of the abdomen that should help see some additional structures. So first off, you can see the stomach margin in this patient. So the black arrow here is pointing out some of the gas that's stuck in the stomach. So you're able to again, this is in a supine position in this patient. So that's what's making the gas bubble migrate more anteriorly as opposed to being up towards the fundus of the stomach. You can once again see the lateral margin of the psoas major, but this time you can see it bilaterally, so you have a good view of that on both sides. The splenic margin can also be made out. It's a little bit, you have to probably look closely, but all of this is the spleen through here. You can kind of see that sort of outlined next to the stomach. So it's going to be the splenic margin, especially the inferior margin, I think, is where you can really see it the best. And then the inferior margin of the left kidney, less obvious in this individual, but you can see just part of the lower left kidney right there. It's difficult to make out the right kidney once again. So oftentimes left kidney is going to be the easier of the two to see, but just depends on the individual patient. And then the ascending colon, so you'll be able to see some of the ascending colon coming up this way. So again, I mentioned before that you should see normal fluid levels. So the stomach air fluid level is expected to be seen. You also expect to see 2 or 3 air fluid levels in the small bowel. And again, the way that that's going to appear is usually you'll have sort of a hyperintensity followed by a hypointensity. So kind of a dark versus light contrast. So here you can see that sort of contrast here, where this is obviously a gas bubble is the dark part. And then below that, you can see where the fluid level would be. Here's another example right there as well. And then you very seldom will see air fluid levels in the colon. So most of the time, what you're seeing in the colon is just going to be feces, but there shouldn't be significant amounts of air fluid levels. And then in this individual, you can also see this hyperintensity right here, which is a renal stone or a kidney stone. In this scan, you're able to make out fat line markings. So this is representing some the error being caused by extraperitoneal fat, especially around some of the pararenal fat surrounding the kidneys. So you can especially appreciate that here on the patient's right side. And then usually you'll be able to make out lung markings below the liver, or behind the liver, I should say, on the right-hand side of the patient. And then in this patient, you can actually also make out clips in the individual. So they also had a surgical procedure up here, which you're able to visualize. And then if you look really closely down here, you can see a concretion here in the lumen of the appendix. So this is called an appendicolith, also known as a fecalith. And finally, we're going to look at the pelvis, the bony pelvis of a male versus a female. So just to remind you of some of the differences of what a female versus a male pelvis looks like. But before we jump into that, I just wanted to point out the clear outline here of the hepatic flexure, the transverse colon, and then the splenic flexure located right here in this patient. You can also clearly make out the psoas major muscles, the margins of the right and the left kidneys. And so then when we look at the pelvis in this individual, you'll notice that it is rather narrow compared to what you'd expect with with a female. So that makes this a male individual. So the female pelvis should be more circular and wider than this. The ilium or iliac bones, you'll also notice, are quite vertically oriented as opposed to kind of flayed out in a more horizontal position like you expect to see in females. You can clearly make out the femoral heads right here sitting in the acetabulum. And then the subpubic angle, you'll notice on this individual, is also relatively narrow, which also suggests that this is a male. Now we're looking at a female scan, and so on this one you can again make out hopefully the difference in the circularity and the width of the bony pelvis. You can also note the more flayed out, wide positioning, so to speak, of the iliac bones. So again, this is a female. The scan is cut off on the bottom so that you can't actually see the subpubic angle, but if you could, it would have a much wider angle than what you saw on the male as well.